Hi, Dr. Tracy, board certified general pediatrician, and yes, I can talk about the amoxicillin rash. So this comment was left by a nurse practitioner on the video I made about why children get hives while they have a viral infection. And I guarantee you she knows the answer to this, but she wants to make sure that you know the answer to this. So this is a common question we get in pediatrics, and it can be a little bit confusing. So I'm going to try to do this really basic. I'm going to leave some things out, but I think it's more simple to understand it this way. Amoxicillin is penicillin, and penicillin is the most common drug allergy. And a lot of children are labeled as allergic to penicillin when they're not. Only 20% of children who are labeled as penicillin allergic actually are allergic. Why is that? That is because children are rashy. They get rashy either from an antibiotic, from an allergy, from a virus like we talked about before, but there's also something called a drug rash, which is a sensitivity, not an allergy. So how can you tell the difference in your child? How does your provider tell the difference in your child? There's a few different ways. The first one is an allergic reaction is typically going to be in the first day of exposure, because this is something that is already ready to go. Whether they're born with it, whether they develop it, they have this in them. The moment they see the penicillin, they will start reacting. So typically within 1 to 3 doses, they break out in hives. They can have other symptoms such as cough, shortness of breath, vomiting, all the way over to anaphylaxis where the body is very sick. The hives rash is going to be a few days into the antibiotic, and the child is typically not very sick. There's just a rash, and it doesn't stop when the antibiotic is stopped. That one's a little harder for you to tell. It's a little subtle for us too, but that's a big difference. The drug rash is a lot easier to tell, but I still hear families say they think their child is allergic. A drug rash is a sensitivity. So when your child is busy fighting an infection, the immune system is really active and it's going about and doing its thing. It then, after a few days, about 6 to 8 days, it starts to look at the antibiotic floating around the bloodstream and starts to recognize it as a foreign body and something that it needs to fight. It is ready to go already. It's eating anything it can to try to keep the body safe. It notices this antibiotic and says, hey, I don't want you to be here anymore, and it throws the immune system at it. Typically, you can get a hive. Not really a hive-like rash, but a red rash all over the body. So the reason you can tell the difference is typically the child is not sick. In some cases they can be. It's usually day 6 to 8, and it stops the moment that you stop the antibiotic. So that's how we can tell the difference. So if your child is on an antibiotic and they have a rash in that first day, it is almost likely an allergic reaction. So we want to stop and not take that antibiotic again until your physician or provider tests you for it, make sure that you can have it. If it's in the middle of your course of antibiotic, especially if you've had it before, it's likely from a virus, but still talk to your provider, stop the antibiotic until you've heard from them. If it's at the very end of your antibiotic course, it's not an allergy, it's a drug rash, your child is safe to take that antibiotic again. Again, this is generalized advice. Always talk to your primary care provider. Make sure you get the best advice for your child. But if it helps you understand the difference of why not every rash is an allergic reaction and why so many children are labeled as allergic when they're really not, I hope this helps. Again, it was super complicated. If you have a lot of questions, make sure you ask. Take care.